Stay.
Our kids like it, they're going down.
I know it does. Yeah.
All right, so we're
Okay. Yeah, we're at 10 people now. Stefano came in, so we're at 10 people, so we're calling it full. And I am going to call this meeting to order of the Mayor and Board of Aldermen for Sunday, March 22nd. Available by telephone are all 7 aldermen: Alderman Jason Bailey, Rick Addy, Mark Hulsey, John Morgan, Janice Antonow, Keisha Howell Atkinson, and Preston Taylor. Also, Chief Jeff McCutcheon is available by phone, and there are only 10 people in the room. The first thing that I will ask the board to do is to adopt the agenda for the meeting. Can I have a motion?
So moved. Second.
All in favor? Any opposed? All right. The only item on our agenda today is to consider a second resolution of the Mayor and Board of Aldermen of the City of Oxford, Mississippi, declaring measures for the control of contagious and infectious diseases and related purposes. So I am going to start by reading this, and it is lengthy, so bear with me. This is the second resolution of the Mayor and Board of Aldermen of the City of Oxford, Mississippi, declaring additional measures for the control of contagious and infectious diseases and for the protection of public health and welfare and for related purposes. Whereas on March 14th, 2020, pursuant to the Constitution of the State of Mississippi and Mississippi Code 33-15-11, Governor Tate Reeves declared a state of emergency existed in the state of Mississippi as a result of the outbreak of COVID-19. And whereas on January 31st, 2020, the United States Department of Health and Human Services Secretary Alex Azar declared a public health emergency for COVID-19 beginning on January 27th, 2020. And on March 11th, 2020, the World Health Organization characterized COVID-19 as a pandemic. And on March 13th, 2020, the President of the United States declared a nationwide state of emergency due to the coronavirus COVID-19 pandemic. And whereas on March 13th, 2020, Mayor Robin Tannehill signed a proclamation of local emergency due to the COVID-19 pandemic. And on March 17th, 2020, the City of Oxford, through its Mayor and Board of Aldermen, ratified this proclamation and adopted a resolution declaring a civil emergency and for the control of infectious and contagious diseases and related purposes, which made certain findings and required, among other things, restaurants to close dining rooms and provide services through curbside pickup, drive-through, and delivery methods only, and prohibited the use by the public of interior or exterior common dining or bar facilities. And whereas on March 18th, 2020, the Mayor and Board of Aldermen adopted an ordinance amending Chapter 1 Code of Ordinances of the City of Oxford, Mississippi, general provisions which specified penalties for violation of the adopted resolution. And whereas the emergence and risk of the spread of COVID-19 within Mississippi continues to constitute a public emergency that has resulted in substantial injury or harm to life, health, and property within Mississippi and in the City of Oxford, and COVID-19 has already been detected in numerous individuals in multiple counties throughout the state and in several individuals within Lafayette County, Mississippi. And whereas on March the 11th, 2020, the Mississippi Department of Health confirmed the first presumptive case of COVID-19 in Mississippi, and as of March 21st, 2020, there were at least 207 cases in Mississippi of individuals who have tested positive for COVID-19, resulting in at least 1 death in the state. And whereas the state of Mississippi and the City of Oxford continue to be adversely affected by the outbreak of COVID-19, and there exists a continued threat to the public safety, private property, and the social and economic welfare of this city, county, and state. And whereas the Centers for Disease Control and the Mississippi Department of Health guidelines for responding to COVID-19 recommend avoiding crowds or gatherings of more than 10 people. And whereas the governing authority of the City of Oxford has reviewed and accepts the findings and recommendations of the CDC and the Mississippi Department of Health, and has further received the same findings and recommendations from health professionals within the City of Oxford and Lafayette County, and accepts those findings and recommendations. And whereas the population of the City of Oxford is comprised of college students, substantial number of nurses, aides, and support staff or physicians, employees, and staff of a regional hospital and several long-term care facilities, and contains significant populations of both older, at-risk individuals and individuals who travel broadly and frequently. And the City of Oxford is a location frequently visited by individuals from surrounding counties, towns, and cities. And whereas section 45-17-3 of the Mississippi Code allows the city to proclaim a civil emergency if it determines that a natural disaster which has caused death or injury has occurred, which the city has done. And whereas the mayor and board of aldermen continue to find that COVID-19 is a natural disaster which has caused and will continue to cause injury, illness, and or death to persons to such an extent that additional extraordinary measures must be taken to protect the public health, safety, and welfare of citizens and visitors to the city of Oxford. And whereas section 45-17-7 of the Mississippi Code allows the mayor and board of aldermen of the city of Oxford, after declaration of a civil emergency and in the interest of the public safety and welfare, to issue such orders as are necessary for the protection of life of citizens and visitors to the city of Oxford, Mississippi. And whereas section 21-19-29 of the Mississippi Code allows the mayor and board of aldermen of the city of Oxford to regulate the entrances to public halls and buildings in the way of ingress and egress to and from the same. Now therefore be it resolved by the mayor and board of aldermen of the city of Oxford that the city hereby adopts the following additional emergency measures that will take effect immediately and remain in effect until rescinded by the governmental authority of the city of Oxford, unless a different effective date and date for continuing effectiveness is stated in such measures: to protect the public health, safety, and welfare of the community from the spread of a contagious or infectious disease, and to eliminate or limit injuries for deaths that may occur in the absence of such measures. Section 1. Because of the likelihood of close person-to-person contact, which increases dramatically the likelihood of the spread of infectious disease, effective immediately and for a period of 15 days, unless extended by motion and order of the governing authorities of the city of Oxford, all non-essential businesses and business functions, including all bars, entertainment venues, meetings of fraternal and civic organizations, bowling, spas, gyms, convention centers, community centers, and parks, except for walking trails, shopping centers, retail stores, except where curbside is available and utilized, shall be closed to the public. This section also applies to municipally owned convention spaces, community centers, and parks, except for walking trails. Facilities shall be entitled to a full refund of any rental sums and deposits paid, with such refunds to be paid as determined by the mayor of the city of Oxford. Section 2, effective immediately and for a period of 15 days unless extended by a motion and order of the governing authorities of the city of Oxford, all churches, temples, and places of worship, assemblages and gatherings, including but not limited to private clubs within the city limits of the city of Oxford, shall adhere to the guidelines of the Centers for Disease Control and the Mississippi Department of Health, and shall limit crowds and assemblages or gatherings to no more than 10 people. This provision shall apply non-exclusively to funerals, weddings, and other social gatherings. Section 3, effective immediately and for a period of 15 days unless extended by motion and order of the governing authorities of the city of Oxford, all essential businesses, agencies, and units of government located within the city of Oxford shall take reasonable measures to ensure that such businesses comply with the CDC and the Mississippi Department of Health recommendations and guidance. It shall implement appropriate safeguards to prevent the spread of infectious disease, including but not limited to mandating social distancing, sending home sick employees and actively encouraging sick employees to stay home, separating and sending home employees who appear to have respiratory illness symptoms, emphasizing work from home policies where possible, mandating respiratory etiquette and proper hand hygiene, maintaining clean and sanitary workplaces, cautioning employees regarding travel, and taking all such additional measures to prohibit and or reduce the spread of this infectious disease, and especially COVID-19. To the extent the enforcement of this Section 3 might impair or impede the practical and safe operation of essential service businesses, the following are to remain operational following the CDC guidelines just stated: city government services, police stations, fire stations, courts, garbage, sanitation, utilities, and such other services as the mayor shall determine. Hospitals, clinics, and healthcare operations, including nursing homes and assisted living facilities, veterinarian offices, gas stations, drugstores and pharmacies, food services to include grocery stores, farmers markets, food banks such as the pantry, convenience stores, take services necessary to maintain the safety, sanitation, and essential operation of the residents, including plumbers, electricians, landscapers, HVAC services, and the like. Banks, community benefit organizations on a case-by-case basis, which would include Interfaith Compassion Ministries, United Way, Salvation Army, Red Cross, Communicare, and the like. laundromats and laundry services, cemeteries, and professional services which service companies and individuals who or which are essential businesses, agencies, or governmental units, such as accountants, attorneys, engineers, architects, to the extent such professional services are able to operate under CDC and the Mississippi Department of Health regulations. Section 4, the city may issue such other orders as are necessary for the protection of life and liberty. Section 5, in ordinance amending Chapter 1 Code of Ordinances of the City of Oxford, Mississippi, general provisions which the City of Oxford adopted on or about March 18, 2020. And then it closes with what Alderman moves for adoption and seconds. And then the resolution, having been introduced in writing at a specially called meeting of the Mayor and Board of Aldermen of the City of Oxford, Mississippi, held on March 22nd, 2020, which was read, considered, debated, and ultimately adopted unanimously, paragraph by paragraph, section by section, then as a whole, and the question be put to a vote. The Mayor reported the votes as follows. So that is the lengthy resolution that is before you. I would ask you to strike, of course, I'm doing this now because we had already posted this before we went through and approved it well so that we had it out in the public's eye as soon as possible. But in section 1, I would remove recreational facilities as we changed that to parks and didn't remove recreational facilities. So we are leaving in community centers and parks except for walking trails, but we will remove recreational facilities unless anyone is opposed to that change. That's the only change that I wanted to propose since we posted this 3 or 4 hours ago. You know, to the public that is watching, you know, the Mississippi Department of Health now reports that there are 207 cases in the state, 5 in Lafayette County. We have put measures in place all along the way to try to protect our community, and that's again what we are doing. I feel like every time I say something within 3 hours, it's all changed again. And I'm hesitant to even talk because I'm like, oh, in 3 hours, people, what she said. Well, that's because it is changing just that quickly. These are strict measures. I'll tell you what they are not in the questions that I have gotten already as it's been posted. There is no curfew associated with this as it currently stands. I believe that I would prefer that people spread their trips out all over the day and evening and night so that we don't have crowds at places. This is not a requirement to shelter at home. This is a requirement to stay at home except for necessary travel and things that it takes for you to daily operate. So this would mean that teenagers don't ride around in cars together and people don't have public gatherings. And we have stressed that the parks will be open, only the walking trails. That means that Agate Park, which has been packed with kids at the playground, can't continue to happen. The playgrounds are closed. And so you can walk the track, you can walk through neighborhoods, but we ask that you not congregate in the parks and around playground equipment. Those are just some of the questions I've gotten so far. And about package stores, liquor stores. Those will remain open as they see fit with curbside delivery as they have permission to do now. So this doesn't change the way that restaurants have the resolution that we adopted a few days ago that allows restaurants to operate by curbside pickup, take delivery, or drive-through. That would continue so that we know that our citizens need access to food, and with grocery stores not fully stocked, we know that drive-through and curbside pickup is an option that many people need. But we need you to stay at home. That's what we need you to do. Drive and pick up food, drive and go to the grocery store, and if you need to go to the doctor's office. But other than that, the future of your community depends on you following these rules. So with that, does anyone on the board have additional changes? I know this was threw it at you quick. So if you have any changes or questions or comments, go ahead.
Mayor, we don't specifically address daycare in this ordinance.
Right.
But I know 2 daycare centers have closed, and I assume there are others that are still operating.
There are, okay. Yes.
Can you go through the additional guidelines that we're looking at for daycare centers?
Yes, this is what, because they all need to follow everything that's considered an essential business is required to follow the CDC guidelines and the recommendations of the Mississippi Department of Health, which would mean that they must be carried out in stable groups of 10 or fewer each day, no interchanging of groups of children. More than one group is, if more than one group is at a facility, then each group must be in separate rooms and no mixing of these groups of less than 10 in each group. Only one group and not change all the requirements that we have seen provided. We strongly recommend that daycare only stay open to meet the needs of the essential businesses that.
Yeah, I know there are a lot of healthcare workers that still need daycare.
That's right.
In order to get to the hospital, but those are good guidelines. The best we can do anyway, as far as keeping the groups limited at 10, and it being the same 10.
Right. As we were putting this together, there are just so many situations that you can address or that will continue to come up and continue to talk through. And so there's that balance of trying to make sure that our healthcare providers can be where they need to be, but encouraging everyone else in the community to personally be responsible. We could implement a curfew now. That's not what we want to do. But we are hoping that people will abide by the stay-at-home request to only travel for necessary items. So that's where we are. Anybody else?
Hey, Mayor, it's John Morgan. I've got a question.
Okay.
And it may be proposed. Hope you want to come back on the screen. But anyway, I don't know if I heard some pushback. Everybody that does curbside, the people that are working, they're constantly handed pins. It sounds small, but they're constantly handed pins to sign their credit cards. And
right.
Not everybody gets to touch a pin that everybody else does. Is there any way that we can do like signature on the file or anything like that where people don't have to do that when they pick up curbside? Or is that something that is really more kind of federal?
I'm not sure that in the 15 days we available on their pay. I know that's available, John, but I'm not sure it'd be available. I think we would probably do more harm to the ability to do curbside than we would increasing the availability of that safe option. One way to address that, and I've seen this all over, is people are carrying paper towels with a little bit of bleach mixture or Lysol wipes, and they're just grabbing everything they grab with those wipes on their side of the equation. I don't think it's a policy matter. We could get everybody to change their method or way in which they take pay without doing more damage to the food distribution.
Well, and I think perhaps we could encourage them to ask people to use their own pens.
Exactly.
You know what I mean? Encourage, everybody's got a pen laying around in their car or in their purse or in their compartment beside their seat. So maybe we encourage them to ask folks to use their own pens.
BYOP.
That's right. That is right. Bring your own writing instrument.
Well, and the other thing that they could do that we do when we take credit cards over the phone is that we just have the client approve it via phone, and we just sign the receipt form. And so it's they're calling it in to get the credit card, and they're not present. We just do approve via phone. So that would be the other option.
That's kind of what I
could do with it. Is it bring your own pen or approve via phone?
Right. Good suggestions. Any others? Anything that you're looking at it and thinking, what did we leave out? I'm sure we did, but this is our.
We got to start somewhere.
That's right. And where we need to start, I know I'm sounding like the mother hen, but where we need to start is by each of our community members taking responsibility and stepping up and saying, I'm going to follow these rules. That's what we need you to do. It is, like I said, the future of your community depends on it, but the health of the people that you are running into depends on it too. You know, I've said previously, we've got so many young people who think, well, this doesn't apply to me, but it does. It applies to everyone. You may be the carrier of the virus, whether it ends up putting you in the hospital or not. So think enough of your fellow citizens, your fellow neighbors, people that you pass in stores to practice social distancing and to follow these rules.
Mayor, the mayor of New York, Andrew Cuomo, said today that the cases in New York, 50% of them are in people from ages 19 to 23. So it is affecting young people.
Right?
They need to wake up and realize that.
I agree completely.
You know, as we're looking here, we're looking at 15 days, push it to 16 days, we'll get our next meeting date, although I imagine we will meet before then. But that is our next scheduled meeting date, will be 16 days.
Whatever you all want to do, I feel like we will meet several times probably before that meeting arrives. And so I think the 15 days is a fair length, but I'm not unwilling to change it either. So whatever you all think.
15 days is good.
Just leave it there.
Okay.
Mhm.
Anybody else?
If no other discussion, I'll make a motion for adoption. It's March.
All right.
This is Janice, and I'll second it.
Any other questions or discussion before we call for a vote? All right, then all those in favor? I'm sorry. Oh, I'm sorry. Stefano, did you want to make any comments? Anybody else? Yeah, okay, sorry. I did not ask for comments from the public, I'm sorry. Yeah,
Mayor, I do have one quick question. So the convenience stores will still be able to stay open, correct?
yes, they should not let more than 10 people congregate,
Right,
but
that's what I wanted.
correct. Gas stations will still be open. Anything else? All right, so we've got a motion and a second. All in favor? Any opposed? All right, so the motion carries. I will say for the public that we have a lengthy list of frequently asked questions that will immediately be posted to our website along with this resolution that was just adopted. We have that one change to this resolution, and it will be posted along with these frequently asked questions. I would encourage you to look through these. And again, send us any emails or direct messages, text messages, whatever, with questions, because I know there will be some. We just couldn't cover it all. But we will get back to you as quickly as we can those in this frequently asked questions list. So thank you very much. That I have a motion to adjourn. And second, all in favor? Any opposed? Thank you. We're adjourned.